Information about tonsil stones. When debris like dead cells, food, as well as other substances are trapped on your tonsils, they give rise to tonsil stones. Sometimes tonsil stones is called tonsilloliths, and it could lead to irritation of the tonsils as well as the throat. Tonsil stones are normally yellow or whitish hard mass that appear in various sizes. The biggest tonsilloliths to be recorded measures about 14.5 centimeters as at 1936. Those who have tonsil stones aren't aware of it. Tonsil stones serve as a resting place for bacteria, and they are accompanied by a very strong displeasing smell. Tonsils represent the two smallish tissue mass that are found behind the throat, with one on each side. Their job is to combat infections that find their way into your body via your mouth. They are fond of trapping viruses, bacteria, as well as other foreign bodies, teaching the immune system how it can fend off germs. Causes these tonsil stones are developed whenever bacteria as well as other debris are trapped within tiny spaces on top the tonsils. Due to the fact that tonsils aren't as common as it used to be, more persons are exposed to it, and ultimately increasing the number of persons that are likely to have it. A more common approach for preventing tonsillitis was to remove tonsils. But now tonsillectomies have become a last resort treatment. Symptoms. The majority of persons who've got tonsils actually show no visible signs. Whenever there are symptoms, they will comprise a very displeasing smell when the stones have been formed, since tonsil stones is a breeding ground for foul-smelling agents like anaerobic bacteria. You get that feeling that you've got something stuck behind your throat or within your mouth. Pain or pressure in your hearing organs, ears. Tonsil stones are similar to yellow or white flecks behind the throat. Sometimes it could pose as a large stone. Those stones may be big enough that they extend outside the tonsils, looking like tiny rocks that have been trapped inside the mouth. Complications. These tonsil stones are practically harmless, even though they can be responsible for causing discomfort at times. They can, however, cause oral hygiene problems. Those who don't brush their floss or teeth often are more likely to end up with this tonsil stones. Plus, the bacteria responsible for this tonsil stones is equally capable of causing gum disease, tooth decay, and other oral infections. Tonsils can sometimes become a breeding nest for bacteria. A particular study has established that these tonsil stones look very much like the tooth plaque that is responsible for gum diseases and cavities. Treatments. Tonsil stones can be treated naturally at home. Often, they detach in the course of hard gargling. Nevertheless, if you notice tonsil stones growing behind your throat without any symptoms, do not attempt to have them removed. People do apply cotton swab for loosening the stone before pressing the tissue that surrounds it. Instead, they should position the swab at the back of the stone and push forward, rather than the other way round. Try not to push with too much force, so you don't cause an injury at that part of your throat. Desist from using sharp objects or your finger for getting rid of tonsil stones. You can get cotton swabs online. If you find it hard to swallow due to pains from tonsil stones, you can experiment gargling with salt water that is warm. See a doctor if someone has got tonsil stone symptoms, but no stones are not visible. You cannot remove the tonsil stones on your home, or you are only able to remove part of it. The tonsils become red, painful, or swollen. Feel pains after getting rid of tonsil stones domestically. The doctor could use laser resurfacing for treating tonsil stones. A process known as coblation tonsil cryptolysis constitutes changing the shape of the tonsils as well as reducing the amount of crevices that accommodate tonsil stones growth. The procedure would require any local anesthetic for it to be completed, and the patients can have their lives back just after a week. Nevertheless, tonsil stones are likely to grow again. Removal. The most reassuring way to avoid tonsil stones for good is by having tonsils taken off through tonsillectomy. It is possible for the tonsils to grow again, but the chances are very slim. A tonsillectomy can be safe, though it could lead to throat pains for many days after the surgery. Just like every other surgery, tonsillectomy has its own fair share of risks. These comprise infection, bleeding, breathing difficulties that are swelling related, as well as a few cases of life-threatening responses to anesthesia. Should tonsil stones become a minor irritation, then the risks combined with surgery stress could be more than the benefits. Prevention. Trying to prevent tonsil growth completely is virtually impossible. For those with chronic tonsillitis, a tonsillectomy could be the one way to avoid tonsil stones. Nevertheless, practicing oral hygiene with regular flossing and brushing could help. Using water sprayer to unsettle the tonsils as well as mouth can get rid of bacteria and debris, lowering the chances of getting tonsil stones. Other conditions that affect the tonsils. Many other conditions can result to pain close to in the tonsils. Discussing with a doctor can help you in knowing things that can cause tonsil stones. Other conditions which can act similarly to tonsil stone symptoms are tonsillitis, whenever the tonsils become swollen and red, and there is difficulty in swallowing, the tonsils could be infected. Tonsillitis is normally occasioned by fever. Strep throat, a tonsillitis type that causes intense pains inside the throat. Similar to tonsillitis, the strep throat do cause fever. Gum disease and tooth decay, pain around the gums and teeth can extend to ear, jaw or throat. If there are untreated infections around the gum and teeth, they could spread to other parts of the mouth. Tonsil cancer, this is equally regarded as tonsil lymphoma and is capable of causing sore at the mouth rear that doesn't heal. Some other symptoms are pain inside the throat and ears, difficulty in swallowing, as well as blood inside the mouth. Nose, ear and throat doctors are known as otolaryngologists and they can treat the majority of throat and tonsil conditions.